Are you a new nurse and you're just a little bit afraid to receive report? You're like, what do I look for? What do I write down? Where do I go? What am I looking at? Like, you have so many questions about it. Well, you don't have to look any further. This video is for you. Hello everyone, welcome back to my channel. My name is Leah and I post nursing-based content here on YouTube every Monday. So if you are someone who's interested in the field of nursing or a new nurse wanting to know a little bit more to make you a more confident nurse, this channel is for you. This channel is for you. So do yourself a favor and hit the subscribe button and hit the bell for notifications so that you can be notified of all upcoming videos I post every Monday. So let's get into today's video. Well, let's relieve all anxiety and we're just going to sit down. I want you to get your favorite drink, your favorite coffee, and just sit down and we're going to walk you through on how to properly receive handoff report. Hey Leah, I have all your patients. Are you ready to receive report? You guys, this is a sentence that I receive every time I pick up a shift on my unit or wherever I float to in order to be a bedside nurse. And it's one of the best parts of my day because I'm like, here we go. I get to see what each nurse did or didn't do. But if receiving a handoff report is something that actually sets you up for your shift, so take a deep breath. The nurse that's giving you a report is not there to reel you. Actually, it's your turn as the nurse to see what that nurse did or didn't do. So the very first thing once you come into the nursing unit is you go up to wherever you are in your unit, however way they align or allow you to know who your patients are. Look and write down your patients. And then what you do from there, I suggest that you go to an available computer while you're waiting for huddle to actually happen to go and look up some pertinent things. Now, if you are someone that comes in early, I do not suggest you come in early, but when I was a nurse, I did come in early, but I'm learning now that coming in early, sometimes you won't even get paid for that part of the shift that you're coming in early to look up your patients. But if you're someone, in order to relieve your anxiety, you want to come in early, then you can actually go through the entire report and look up all the information in regards to your patients. But I would suggest do not come in early. But when you come in, at least come in at least 5 minutes to put your stuff down, to know what your patients are, who are in your set, write it down, and then go to an available computer. And I want you to look at these important things before you receive report. First and foremost, you're going to look up who your patient is, their first and last name, their room number, so that you can know exactly where all your patients are. In a perfect world, all your patients will be all in consecutive rooms, so you don't have to go all around the unit, but that is not a perfect world. So look up the room number, look up your patient's name, and then the most important thing is to look up exactly what their number one diagnosis is. A lot of people have a lot of things going on with them, a lot of chronic diseases that they may have in their medical history, but look to see what they're primarily there for, which is CHF, which is maybe they had their appendix removed, maybe they were getting their gallbladder removed, whatever it is, write that down so that you can know exactly what that patient is there for. Now, the next thing you can do is to go to the vital signs, and this is all, this whole video is all in line with Epic because I use Epic. I do not know how any other charting computer system goes, but this entire video is based off the Epic charting system. So number one, it goes to Epic because I love Epic. But the next thing is to go to your vital signs. Actually go and look at the most recent set of vitals. Make sure you have the most recent set of vitals that were within the last 4 hours because that is needed. They're in an acute care setting. Once you look at your vitals for your last most recent set of vitals, I want you to look to make sure they're all within the proper range. Make sure that they're not out of range. Typically in my hospital on the unit that I work, a systolic blood pressure over 180 is something that you need to intervene. So you need to make sure if it is over 180, look maybe at a note, the last most recent note from a nurse to see if there was any intervention, or go to the MAR and just see if any intervention was given for as the medication. But you want to make sure your vital signs are all within the normal ranges. I know all of my normal ranges because there is a standing order in Epic that all of our doctors, whatever a patient is consulted in, that is there. So for instance, a systolic blood pressure that is over 180, we need to intervene. Anything I think below, for as a diastolic of 50, we need to intervene. Far as heart rate, anything over 110, but especially anything over 130, you need to intervene. So you need to make sure what your patient's range is, right? According to however way your doctor's standing order is for that specific unit, look to make sure they are all within range. They should all be within range. If your vital signs are not within range, you need to make sure that you're asking the nurse, if whoever had that patient before you, if they intervene and what is needed. Do you continue to monitor? And if you continue to monitor, what was the note or the message given to you, to them as a nurse, in order to know when you need to intervene. Make sure you know that. So the number one thing, again, is to look at your vitals, look at if they're abnormal. If they're abnormal, know what needs to be done, and your nurse will tell you that in the report. The next thing I do is to look at the range. A lot of times, some people will come in with a blood pressure that is steadily, 130s over 130 over 60, 130 over 60. They stay within that range. So look to see what your patient's range and all of the segments of vital signs, as far as blood pressure, heart rate, respirations, all that, to see what the range is, because everyone has different ranges. Yes, it may be a high range, but that is the range. And a lot of times doctors don't intervene if doctors don't want you to intervene if that is the range. So look at the range and know that, keep that in mind, or write it down somewhere on your paper. The next thing you should look at is lab work. You need to make sure whatever abnormal lab work, write it down so that you can be aware and report, to make sure that the nurse who's giving you a report can tell you how they have intervened or how the doctor wants you to intervene. Some of the major things that I look at is hemoglobin. I look at all their electrolytes to make sure that they are within normal range. If they're not within normal range, then I'm looking to make sure that I write down what that abnormal range is, so that when I get report from the nurse, they're letting me know, hey, their magnesium low, so we replaced it, and then we'll do another check probably at 5 a.m. in the morning, because I work night shift. So yeah, make sure those are the three things. If you have no other time to look up anything else, you're looking up to see who your patient is, their first and last name. You're looking to make sure that you have the room number, so you know where to go in order to receive bedside report. The second thing is that you're looking at vital signs, looking to make sure that they are within normal range. And if they are not, you need to make sure that your person who's giving you a report is telling you how they are intervening or how you're monitoring that patient. The next thing is to make sure lab work is all within normal range. And if they're not, you need to know how they are replacing it. So that kind of sets you up to know, the general things about your patient, so that you can go in and actually have questions for your nurse, so that when they're giving you all things that are not pertaining to your patient, that you can actually drive the report. So those are the three things you do when you go to your computer. I suggest you do when you come into your unit before you receive report. So once you are done looking up all this information, you stand at huddle. I suggest you stand at huddle. Do not start receiving report while they're giving huddle, because huddle is very important. In huddle, you are making sure that you're listening to the charge nurse, because you will have patients. Sometimes in our unit, we have patients who are one-to-one sitters. That means you need to make sure there's coverage. So you need to know that if your patient is a one-to-one sitter, you need to make sure if your patient is a sickle cell patient, if they have a PCA pump, if your patient has a procedure that's going on during the shift, because these things and these notes will help you kind of plan your shift, and you already kind of know what you have to look out for. If your patient is on med hold, things of that sort. So pay attention to what's going on to the floor, because that is important. I know we have our own set of patients when we go in, and a lot of times you can't think about the whole unit as a whole, but the whole unit as a whole does affect you as a nurse. You cannot just be engrossed into your patients, because you need to know how that would affect your day. So pay attention specifically to your patients, but pay attention to what's happening as a whole, as a unit, because that's important. The next thing, you are to wait for your nurse to find you, or you go and find the nurse. A lot of times we actually can know who our nurses are before, so make sure you know that, because a lot of times how they divvy up patients, you will have to get report from several different nurses. In a perfect world, you should probably only get report from one nurse, but that does not happen. It's sometimes hard, because sometimes you have heavy floors. So then you're just waiting around for a nurse to either find you or you find a nurse. This is a part that you just breathe. You breathe. I suggest you find a hard working surface, or your computer on wheels, and make sure that is there, and make sure that you follow the nurse to the bedside. Make sure if you're not going to the bedside, that you're standing outside the door. Our hospital ensures that you stand at the bedside so that your patient can be involved in handoff report, and they can have their notes and their concerns or their complaints, and you can kind of get the gist of what happened in the last 12 hours or whatever, how many hours have occurred. But make sure you are near the patient's door when you're giving report, or actually at the bedside. When that nurse is giving report, this is the number one thing. Number one, do not interrupt that nurse. Do not interrupt. I don't care if she's telling you about her vacation from 5 months ago. Do not interrupt her. I know it can be annoying, but just let that person talk. I would say give them at least like a 60 seconds or maybe a minute or two just to talk and vent, because a lot of times nurses have difficult shifts and they don't have other nurses to vent to, so let them vent. They may tell you things that are not pertaining to this patient. I hope they don't, but do not interrupt the nurse, okay? So let them finish, and when you feel that they have kind of stopped and they're just rambling on after 1 or 2 minutes and you feel that you may need to guide them. These are the things that you should look for and pay attention to when you are receiving a report. A lot of times a good nurse will tell you all of these things, but if they do not wait, do not interrupt, and let them talk, and at the end that they feel that they are done, you can ask them, say, are you finished? And when they're finished, then you can ask the following question. So if that nurse has talked for at least 2 to 3 minutes and hasn't told you any of these following things, then it's your job to interrupt and ask them first, are they finished? And then you progress to ask the following information. This information will set you up that if you don't have time to go back to the computer to even look up anything else, you know how to intervene just in case a patient has an ERT or a cold or anything else, okay? Number 1, you can ask when they were admitted, as far as the date they were admitted, and what was the major complaint that they had when they were admitted. I ask these questions, and if they do not know, I will teach you in my next video where you can find this information. Next, you want to ask if the patient is alert and oriented. Are they alert and oriented times 1, 2, and 3? And if they are disoriented, ask them what are they disoriented to, because you want to know a baseline of the patient so that when you come in, and you're going to have to assess that patient, but you want to know what the baseline and how they were prior to you coming in. Next, you're going to ask the nurse, how do they ambulate? Do they need assistance? Are they a one assist, meaning do they need just one person to help them, or 2 people? Do they use assistive equipment? Do they use a cane or a walker? Do they need a Steady? All those things, you need to make sure you understand how they ambulate, and if they are fall risk, have they reported falls in the last 3 months, so that you can know how they ambulate. God forbid they need to go to the bathroom and the CNA is not able to help you. The next thing you need to make sure is if they're on telemetry, see if there is actually a telemetry order. They will tell you that, and if they are on telemetry, they need to tell you what their rhythm is. Are they normal sinus? Are they in AFib? Next, you want to ask, are they incontinent? Are they able to roll if they are incontinent? Do they get out of the bed? Do I have to use Depends? If they are incontinent, is it bowel and bladder, or is it just bowel, or is bladder? So that you can know kind of how you need to intervene and if you need to help the CNA. Next, you want to ask them, do they take their pills whole? If they do not take their pills whole, do you crush them in applesauce? What do they prefer? Whatever it is, you need to make sure you ask those questions. Next, we go to the lines. Do they have a working IV? Can you flush it? Does it draw? You need to ask if they have central lines. If they do not have an IV, if they say, oh, the patient's okay not to have an IV, ask them, do you have a doctor's order that will allow us to go without an IV for this shift? And I would suggest if they say yes, to make sure that you actually have an order or a note somewhere from the doctor. And if they don't, you need to follow up once you are done getting a report to make sure. God forbid something happens. You don't want to say, oh, I didn't have an IV and they said it was okay. Who said? You don't have a documentation of that. So make sure you do have that. Next, you need to ask if they are on room air, meaning are they able to breathe without supplemental oxygen? If they need supplemental oxygen, you ask them, do they use a nasal cannula? Or if they do need a nasal cannula, what liter are they on? Are they on 2? Are they on 1? And ask them, is this something that they need only acutely right now? Or is this something that they use when they're out of the hospital? What is their baseline? Can we wean them off of oxygen? And then also check for orders once you are done receiving report. Next, ask their diet order, specifically also if they're on fluid restriction, are they compliant to the fluid restriction? Are they compliant to the diet? Next, you want to make sure if they have any procedures, if they're MPO for certain procedures, have they been compliant to that? I would also ask if they have allergies. A lot of times you could look this up prior to your shift, but ask about the allergies and certain things like latex allergies. Now, to bring things home, the very last thing you need to ask the nurse is, what's the plan? What are we going to do with this patient while they are here? Also, where would this patient be discharged once they are medically stable? Some questions, and people were asking, hey, Leah, when you are receiving a report, do I just write something down on a blank sheet of paper? Do you write things down on a brain sheet? I'm going to let you know that personally, because I do use Epic at my hospital, that in Epic, they have a link that says print patient summary. And from print patient summary, you can actually print the handoff report. And this handoff report is basically the snapshot of your entire patient. It tells you when they are admitted, their diagnosis, who's on call for them, their IV access, their central lines. They give you their scheduled meds, their PRN meds. And I'll try to link a copy of what that looks like, a picture here so you can see, but you can actually print that. And that's what I actually use. And from there, when I'm receiving a report, I write on the back of that paper and just write everything that I need to know. And when I actually finished report and I go through the entire chart in depth, that's when I will fill it out. So again, you can use the Epic print off summary. I think that is an excellent tool. I used to have a brain sheet, and if you do feel like you need a brain sheet or you want me to create a med-surg brain sheet for you, I can do that as well, because I did have one from orthopedics, and I'm pretty sure you can use the same one now for med-surg, and I will give a link to that. I have one already posted in my Stan store and also in my Etsy store. So a good brain sheet, I do have one for orthopedics, but you can also use it for med-surg. But if you do not have time to go and find a brain sheet, you guys, Epic has a whole bunch of tools, but I would suggest printing the patient handoff summary report sheet straight from Epic, and I'll probably try to link some ways that you can do that to help you walk you through how to print that for you guys. But this will set you up for your entire shift. So what I do is I print all the patient handoff reports straight from Epic for all of my patients, and then when I am receiving a report from the patient that is leaving, I write on the back of it, and I don't write on the front of this patient handoff report summary until I actually go through and look up the information on my own. So you guys, I know that getting a report can sometimes seem like, what do I do? Who do I turn to? What am I listening for? But I want to let you know and give you some type of encouragement to know that this is the best part of your shift, because this is your job to make sure and to determine if they did their work or if they didn't do their work. I always say that you can determine the type of nurse that you have when they give you a report. If this video was a lot and you feel like you need something to keep with you when you are receiving a report, I will write down an entire step-by-step process for you so that you can be confident and you can actually enjoy receiving a report from your nurse that it will be leaving. I want to commend all of you all who are past the NCLEX and you're currently at the bedside. Nursing can be difficult, you guys. It can be difficult, but I want to let you know that you are blessed and you have a wonderful career. Do not give up on it because you have a little hiccups. I encourage you to keep pressing on, and I'm saying that because I actually was there where you are. And so if you have nobody else reading for you, I am reading for you, and I know that you are going to do great things in nursing. So run and tell all your new nurses about this video to help them adequately receive handoff report, because I know it was going to be helpful for you guys. So I hope that this video has been helpful to you all who are on your new nurse journey. If it has been helpful, do yourself a favor and comment below and let me know what tips out of this video you will utilize during your next handoff report. Let me know what you will utilize and what you will use to help make your handoff report successful in your next shift.